Welcome to Nourish MD, Doctor-Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice, Private Physicians Medical Associates, PPMA, with your host, registered dietitian and nutritionist, Meg Tancredi.
Hi, everyone, and welcome to the Nourish MD podcast. I am your host, registered dietitian Meg Tancredi, and today we have a special guest, Dr. Burak Ozgur, and I'm very happy to have him here because today we get to talk all about spine health, which is a really, really important topic. So before we get started, I'm going to read his fabulous bio so we have a little bit of information as to who he is, and let's go ahead and get started. So Dr. Ozgur is the medical director of the Hoag Spine Institute and a nationally recognized double board certified neurosurgeon known for his leadership in minimally invasive and restorative spine surgery. He specializes in treating a wide range of spinal conditions from common degenerative problems to complex issues such as tumors, scoliosis, and trauma, using techniques designed to reduce tissue disruption, shorten recovery time, and preserve mobility. Very important. Dr. Ozgur completed his medical training at the University of Vermont and advanced neurosurgical and spine fellowship training at UC San Diego. He has published extensively, including scientific articles, book chapters, a leading surgical textbook, and a book sharing inspirational patient stories. Oh, I like that. As a pioneer in modern spine care, Dr. Ozgur helps build a comprehensive, patient-centered program that brings together conservative therapies, advanced diagnostics, pain management, rehabilitation, and state-of-the-art surgical options. He is committed to compassionate, transparent care, always exploring non-surgical treatments first and using surgery only when it offers the best path to restoring function and quality of life. His mission is simple: to help patients move better, hurt less, and return to the lives they love with confidence and support. I absolutely love that. I think that's wonderful. You hit on so many different things that I want to talk about today. I love patient-centered care, going for more of like the non-surgical techniques first is really great. So when I work with patients on nutrition and lifestyle, they will mention pain. And so one of my first questions to you today is, how do we discern between what is I kind of want to say normal pain in terms of the aging process, and when should we actually be concerned when it comes to pain?
Yeah, great questions. Thanks for having me on the show.
Thank you.
Happy to chat and talk about all of this because I'm passionate about it, excited, and in the end, we want patients to be better and happier and healthier. As far as spine, yeah, it's a ubiquitous problem. Right? Everybody has back pain at some point in their life. It could be debilitating, but thankfully for most, it's temporary and it goes away. And the vast majority of people don't need surgery. So here I am as a surgeon. I love to perform surgery. I'd love to be in the OR every single day,
Wow.
but the reality is I don't need to be because most patients don't need surgery. Most patients don't need me. They need the other spine providers like physical therapists, chiropractors, pain doctors, trainers, so on and so forth. So we've developed a spine institute here at Hoag where it brings all that together. So we work together, we have regular meetings, sit around a table, learn from each other about how to better care for patients. And the surgeons around the table are the fewest because we don't need a ton of surgeons. Like I said, we don't have patients that all need surgery. Patients all need compassionate care. They need a proper diagnosis and then uh, the best recommendations for treatment. So the majority of people, yeah, we'll hurt our backs because we just started playing pickleball, or we fell, or we tried to pick up something too heavy. But thankfully, our bodies heal, it goes away, and we're fine. So I think most of the time you just kind of you listen to your body. You kind of back off what you were doing. You take some anti-inflammatories, you rest, and then you gradually get back to your activity. Now, if it lingers and you're still in bed, or you can't get to work, or you have numbness or tingling, you have weakness, then we're thinking, okay, maybe something's wrong. So you see your doctor, you have him or her evaluate you, do a proper exam and history, and then even at that stage, usually still, you don't need to see a surgeon. They're gonna, do an exam and figure out, is this something serious? If it is, they're gonna send you to the emergency room or urgent care to get further follow-up. Or if it continues to go on and on, they may order some imaging, MRI, X-ray, CT scan, whatever is indicated, and then we go from there. But the majority of people, they just rest, they take some anti-inflammatories, and they start feeling better.
Okay. I have a I had as soon as you said pickleball, I feel like, I mean, that is taken off. I mean, pickleball's kind of been around, but it's become very popular in the last like couple of years. Have you noticed? I mean, are people coming in for that specifically, like injuries related to that? Have you noticed a pickup?
Yeah, yeah, certainly, certainly. The first half of my career, it was everyone come in is a golfer, and their swing is off, or they hurt themselves. But yeah, in the past few years, I'd say it's half golfers, half pickleball players, or people who play a lot and they're looking to get back to it quickly because they've injured themselves from something. So it's definitely huge, and I think pickleball. I just put it with any other sport. Like, you have to build up to it. You have to stretch. Nobody wants to stretch. Nobody wants to
True.
warm up. We just want to get on the court and play, myself included. Like, I play a lot, and it's a great sport, great activity, great cardio. But just like anything, we should stretch and properly prepare for our games.
Absolutely. I'm really glad that you said that because I know a lot of people who, whether it is the gym or a sport that they go do, it's just, oh, I'll just do a little bit of, some side bends or, quad stretching, and then I'm ready to go for an hour of play. And I always think, why doesn't anyone focus on the warm up? You got to get your body warm before we just dive right in, right?
Yep.
Prevent injury.
Yep.
So what can we clarify what normal aging as far as the spine is concerned, like what that looks like normal wear and tear? Am I thinking about that right?
Yeah, I think it's sort of like, if you suddenly decided tomorrow, I'm going to run a 5K, a 10K, and you haven't been doing that, oh, you're going to be achy and sore. You expect your knees to hurt, your ankles, your back. So I think with your back, it's a similar thing. If you start doing something you haven't been doing in a while, you expect it to be achy or sore. Or as we get older, you're like, well, I can't run as fast, or I can't, my back aches a bit in the morning, but you know what? After a few minutes, I'm okay, and I can get to work, and I can get to school, or whatever. I think that I consider it kind of just aging. We're getting older, and we're not 20 years old anymore. What's different is, like, if all of a sudden you do something or you hurt yourself, and now I've got this electrical shock going down my arm, my leg. I've got weakness, I got buzzing, I got tingling, or the pain is really bad in my neck or my back, and I no, this is different. Usually something stands out as being different, and you're usually right. Like, this is you know your body the best.
Yeah. So let's say, okay, I'm experiencing those symptoms that you just described, and they have now booked their appointment and they're waiting for their doctor. What could they do in the meantime to kind of take care of that pain?
A lot of people will start with just anti-inflammatories, or they'll ice, or they'll heat, and I think those are all fine as long as you don't have a contraindication to taking a certain medicine. Over the counter Tylenol or ibuprofen is reasonable, and see if it gets better on its own. Ice, heat. People ask which one.
Yeah.
I think it's quite variable. I say try both and do whichever one feels better, and then listen to your body. Um, and then again, if it seems like it's out of the ordinary, this is different than last time, or this is something new, it's better to be safe than sorry, and see a professional.
Because movement can be pretty therapeutic. So let's say I have done something to my back. There's some kind of different pain going on, right? Again, is going for a walk, like having some sort of like gentle movement, can that be helpful? Or because I know sometimes people will like it's counterintuitive, right? Oh, I'm in pain, I need to not move.
Mhm.
But would it be helpful to try going for that walk or doing some sort of gentle movement?
In general, it's still good to be active. Doesn't mean go to the gym and bench press and squat 200 pounds,
Yeah.
but stay active, walk around in a pool or jacuzzi, um, go out for a walk, walk the dog. It's still good to be active if you can, for sure.
Do you have an opinion on Pilates or yoga as like a regular practice just to kind of keep things limber and flexible in your body?
Definitely. I think I'm a fan of yoga and Pilates, of Tai Chi, of whatever somebody likes to do. I think do it. It's not one is better than the other. It's doing something is better than doing nothing. Whatever speaks to them, just do do something 3 to 5 days a week if you can. Be active, stretch. And if you love Pilates, do that. If you love to swim, do that. If you love yoga, do that. I think they're all good. It's just uh, don't commit yourself mentally to something that you're not going to do. This
Right.
is we just passed New Year's and everybody has a resolution. Pick something that you like that agrees with your body and just do it. Do it regularly.
This is exactly what I talk about with patients who come in because behavior change is at the core of, when we set goals and what outcomes do we want. I actually just recorded a podcast with a psychologist and we were talking about people tend to be more like outcome focused. And
Mhm.
so we want to think about the behavior change. And so, what is it that we can do today that's going to drive that, right? Like the little steps that we can take. And part of that conversation is absolutely finding things that you like to do because you're more likely to repeat the things you like to do. What is it that you like doing? How do we implement that on a daily basis and then keep that going? Transform your health with PPMA's personalized support from our expert registered dietitian. Get the clarity, confidence, and tools you need to feel your best. Visit privatemds.com to get started today. If you could correct one major misconception about spine surgery, spine care, what would it be?
Yeah, so a lot of it comes down to, I think, like anything in health, is there are a lot of different opinions. There are a lot of so-called experts out there. And I'm not just talking about spine, I'm talking about anything in healthcare. And especially with social media, there's so much misinformation or disinformation out there. Some of it's valuable, some of it's not so much. And people tend to rabbit hole into something and then they're just narrowly focused on that. Um, the the misconceptions are that spine surgery is terrible, it's debilitating, you're going to be fused from head to toe, you walk around like a robot, you can't bend or do sports anymore. And that's just not true. First and foremost is seek a professional. If it looks like something serious and you may need intervention, like a surgery, get multiple opinions. You'll probably hear different opinions. That's okay. And then until you feel happy and comfortable with your decision, don't rush into anything. Um, and it's okay to question your providers. How much experience do you have in this? How was the last time you did one of these? How many do you do a year? Can I talk to one of your patients who had such and such done? Those are all valid questions. And if a surgeon feels offended about any of that, then that's a red flag. Go see somebody else. I tell patients, even if they say, "I want you to do my surgery," I'm like, "Why don't you go see other opinions and then give me a call?" it just makes them feel even more happy with their decision. So I never twist anyone's arm. I say just this is a really important decision for you to make. I won't get offended. In fact, I want you to go get other opinions and do whatever you feel is safe, whether it's with me or with somebody else. Second is that most people who do need spine surgery, now we have such great, better techniques, equipment, technology that most can be done minimally invasively. Sometimes with robotics, sometimes with navigation, minimally invasively. It's changed everything. It's so much better. The majority of my patients go home the same day.
Oh,
If they
wow.
stay overnight, that's that's, a proportion of patients, but the length of stay after a surgery, even in spinal fusions, is 1 day. Like most patients go home pretty quick. They're active, they're walking, they're moving. Nobody's like just sitting in bed. I want everybody up and about right away, whether cervical surgery, lumbar surgery, or what have you. And again, that includes spinal fusions. So most patients don't need a fusion, but even if they do, you're still active. And within 4 to 6 weeks, most patients are back to physical therapy, starting to exercise. And I have a lot of patients who have had spinal fusions and are back to sports, including professional sports. So it is not the end of the world. Doesn't mean you can't be active and play pickleball again. In fact, I have a patient who just he's an older patient who just had surgery by me 6 months ago, and he's emailing me from Palm Springs asking when we can play pickleball together. He was
Oh, that's great.
challenging me to pickleball, so we
Yeah.
actually did a video of that. So I encourage people to get active. Again, be careful with the opinions that you get or the decisions that you make. Take your time. Don't feel like you're at a used car salesman's office.
Yeah.
This is a serious decision you need to make, and then whatever you feel comfortable, go with it, and then you have your homework to do. Like it isn't like a miracle has been performed, a miracle drug. You have to do your PT, your activities, your exercise, your proper eating, your get into better, healthier habits. That's part of the deal in terms of getting a good outcome.
I want to like applaud at this point because I thought that was wonderful. I love that you are very encouraging of any patients and anyone listening to ask questions. I think it's so important, especially when surgery is involved, which is a really big deal. And for a lot of people, it can be scary and overwhelming. So I think having questions answered and feeling really comfortable with your healthcare team is really important. So I like that you said that, who you are, and then you're encouraging people to ask the questions is really nice. Um, the second opinion, finding a second opinion, I think people from the patient's perspective probably might be worried about offending the physician,
Mhm.
but it really is in their best interest, right? To find that second opinion. They feel more, affirmed in their decision to move forward or to not. So I think that's really great. So in your bio, you mention lots of publications and a book sharing inspiring patient stories. When did you compile that?
So it's a funny story. Um, the path to becoming a physician is really long, as you can tell how old I am. I'm like 100 years old. And so through that long journey, you have a lot of experiences. And I've seen a lot of patients and learned a lot from my patients. And I've had amazing, um, medical phenomenon that I've been a witness to. And it becomes a story that when you're at a cocktail party or at a dinner, people ask for stories. So I
Right.
tell my stories
Yeah.
and what I learned from those stories. And people keep saying, "Oh, you should write a book." I'm like, "Okay, I'll write a book." So I wrote a book, and
Oh, there we go. Oh, grabbing life by the horns. Oh my gosh, amazing.
so that's a
That's
book.
fantastic.
It's on Amazon, and it's basically a compilation of a lot of these stories and what I learned from them, and really interesting stories. I thought the ones that friends and family would say, "Oh, that's amazing," or whatever. but
Right.
they're all kind of neat little stories. And even the title is one of the patient stories. So these are all like things that I've learned over the years. And my dad's a neurosurgeon as well. So things I learned from my dad. And it's just one of those things that, every life experience or interaction, I think there's like a learning moment and something that we can appreciate. And then it contributes to you being a better person and better provider by learning from those experiences and applying it to others.
I think that's really great. How many stories do you have in there?
Each story is a different, each chapter is a different story. I think there's, looks like 26 stories in there.
Oh wow. Oh, that's so great. I love that. Did you enjoy putting that book together, or did you enjoy something that's more like scientific based? What do you
No, I enjoyed this much more.
Oh, okay. Okay, very nice. That's
Yeah.
wonderful. Your background is very impressive. So you also said your dad is a neurosurgeon?
Yes, he's retired now, but he's a neurosurgeon as well.
Oh, okay. Fantastic. So it runs anyone else in your family, physician of some sorts, a surgeon of some sort?
Yeah, we have surgeons and nurses and in my family as well. My son-in-law is applying for a residency in neurosurgery, so he wants to get into the field as well.
Amazing. That's wonderful. Well, it's really nice to have, heart-centered, compassionate people in healthcare because patients who are coming in are already vulnerable and feeling, whether it's pain or just overwhelmed with whatever it is that they are working on. I mean, I work with people on diet and lifestyle and behavior change and already just I would never expect someone to just change their diet right away, right? We have to take things in small doses and having, providers who, make that process a little bit more approachable and communicate, hey, it's okay if you don't understand. It's okay if, you don't make your goal or if you don't, get it, right the first time. It's okay, right? So people need that warmth and compassion and reassurance, and it sounds like that's something that you come with. So that's really refreshing.
Thank you. Well, I do think it's critical, especially in this day and age. Again, I go back to social media, but also AI and our access to that is making it challenging because I feel like right now, like everybody can now have access to their imaging, to their charts, as they should. The
Mhm.
problem is you then have access, but then you can't interpret. So then people are putting their imaging reports or such on an AI site, and
Mhm.
then they're freaking out because, oh, it says I have this, I have that, and oh my God, am I dying?
Right.
And so I have patients who come in and for the first time, and they're like, "Here's my report, and it says I have such and such, and can you schedule
Well,
surgery tomorrow? And I want X, Y, and Z," as if they're ordering a burger and fries at a
yeah.
restaurant. I'm like,
Right.
"Wait a minute, let's back up. Let me show you the MRI. Let me show you what I see and what the explanation is." Because there are a lot of findings that are just normal or that we expect, like past the age of 40, everybody's going to have a finding on their MRI that's going to sound scary on a report, but you
Right.
need the interpretation for what does this mean and does this correlate? And I don't want to get political, but what ends up happening is healthcare, I think the reimbursement is twisted because what ends up happening is surgeons are paid more to do more, to cut more, to put in screws and hardware. So they're
Yeah.
trying to talk people into big surgeries, which quite frankly, a lot of times people don't need because surgeons going to make more money. So there's a conflict of interest for sure. And so that's why it's unusual to talk to a surgeon who says, most people don't need surgery. Most people don't
Right.
need me. I want to operate on people who have indications for surgery. They need it, not I need to pay my bills. And
Right.
that's unique. Like I have to say, like, and it's sad that a lot of surgeons don't think that way. A lot of surgeons are looking for their next paycheck.
Right.
And that's why I'm really passionate about get multiple opinions until you find somebody who's really seems like they're your advocate and they're doing what's best. I think healthcare providers should be paid for their outcomes and helping patients
Love that.
whether they need surgery or not, and prevention and proper health and exercise, and all that should be incorporated, I think.
I would like to put that on a giant banner if we can and just drive around town with that, because that's what I believe too, that we should be focused on that, not just reimbursement rates for surgery. That has to be very frustrating, and it's very unfortunate that it's rare that you are saying go find the second opinion. If we don't need to have surgery, we're not going to do it. And I like your point about AI. I have noticed that also. Some people will say, hey, I typed in, this diagnosis, or I typed in, some sort of issue into Chat GPT. And I very much want the patient, I want everyone to understand, what's going on. So for example, I talk about blood sugar and diabetes all the live long day. I love it. It's so, I don't know what that is. I just enjoy talking about it, but I want the patient to feel clear as to what's going on in their body. I want them to understand. I want them to know what the causes are. I want them to, but when you start, going down the rabbit hole, almost with anything, it can make things seem worse than what they really are, to the point where you think maybe there's no solution, or I'm doomed, or my, lifespan is going to be shortened, by a decade. And it's kind of like, it's good to have an understanding of what's going on in your body, but absolutely, let's talk with a human who does have the compassion, who does have the ability to, break things down so we can really understand them. And one thing too, I think it's really important to note that when, we've been trained a certain way. So if I were to speak in all scientific terms or jargon, right, with a person, they're not going to feel, one, they might feel intimidated to ask questions or to ask for clarification. So I think it's really important to make sure we are aware of how we speak to people, and that it's not like they're incapable of understanding, but using terms that are just, the layman's terms, right? And so, and checking in with them, does that work for you? How do you feel about that? Right. And that's where that human aspect, that compassion comes in. So,
Yeah. And
and
it's
I hope
not
you're glad
taking
you
advantage when
right.
people are suffering. Like
Yeah.
right now, it's easy for you and I to have a conversation. We're comfortable, we're safe, we have a roof over our heads, and we can have a conversation about these things.
Yeah.
But the patients who come into a provider who are suffering, they're overweight and they can barely get out of bed, and they have pain here and pain there, or a spine patient who has such and such, and they're suffering, and they're desperate for a solution, a cure. They want a hero, and then the surgeon's like, "Here I am. I can cut you and do this and do that," and makes all sorts of promises. That's the patients are vulnerable, and that demands more compassion and honesty, not a vulture who's looking to just cut. And because you can justify on almost any MRI, you can say, oh, here's this problem, that problem. If I only put in these screws and rods and metal plates, you'll be cured. And a lot of patients sadly will believe that because they don't have reason to not believe it, oh, they're a doctor, they must be knowing what they're
Right.
talking about.
Right.
So that's the thing that's really saddened me is physicians who take advantage, and whether consciously or subconsciously, and they don't know any better. That's the sad thing. And the patients who, I have patients who don't agree with me. They've been told by somebody else they need surgery. I look at them and I'm like, well, I don't think the problem's from your spine. I think it's because of your hip. I think it's because of such and such. Or, you know what, with proper diet, exercise, and weight loss, I think your back pain will go away and you don't even need surgery. They
Mhm.
don't want to hear that. They want a quick, easy fix. And someone offered to cut them and say, you're going to be cured tomorrow. Well, that's dishonest. And sadly, I see a lot of those patients come back. They had surgery by somebody else and now they were worse, or they have a complication.
Oh,
They're like, you were right. And now can we fix it? Now. So it's sad, and we have an obligation to be truthful, honest, and compassionate. And I hope everyone can do so and treat everybody with respect and be able
Yeah.
to help more people.
Right. Absolutely. Well, that's wonderfully said. I wish that was across the board how everybody, acted and thought. I think that's very honorable and you have a lot of integrity. So I appreciate that very much. And again, thank you. Thank you for taking the time today, for being here. Are there any last words of advice you would like to leave our listeners?
I think it comes back to most of medicine is prevention is still better than anything. Healthy lifestyle, including diet and exercise, will actually cure so much more than dealing with things after you develop a problem. So, and a lot of providers, we would be out of business, which would be a good thing if people need us to cut and to do massive things. So, yeah, the biggest advice to people is take care of yourselves. Diet and exercise will go a longer way than dealing with problems after they develop.
Absolutely. 100% agree with that. And on that note, we'll go ahead and end our session today. Thank you everyone for joining and listening to Nourish MD. Please like and follow us on Spotify and Apple Podcasts. Again, thank you so much, Dr. Ozgur, for being here and talking with me today. This was really great. So thank you so much, and talk to you guys all later. Bye.
Bye-bye. Thank you.
Thank you for joining us for today's episode of Nourish MD, Doctor Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.